Hi all, welcome back to my channel. I hope you guys are doing good. Today I'm going to discuss about central venous catheter, the different types of central venous catheter and how to take care of it. Let's move on to the topic. A central venous catheter or CVC is a catheter placed into a large vein, commonly placed in veins in the neck, that is internal jugular vein, or chest, subclavian vein or axillary vein, or groin, that is femoral vein, or through veins in the arms such as basilic, brachial, cephalic, or medial cubital vein, also known as PICC line or peripherally inserted central catheters. A central venous catheter CVC is also known as central line C line or central venous line or central venous access catheter. The main indication of CVC is difficult peripheral venous access, delivery of certain medications or fluids, prolonged intravenous therapies, or specialized treatment such as chemotherapy. In view of contraindications, there are no absolute contraindications to the use of central venous catheters. Relative contraindications include coagulopathy, trauma, local infection at the placement site, or suspected proximal vascular injury. Let's talk about the types of CVC. By site, it's been classified into 5 types. The first one is percutaneous central venous catheter or CVC. Second one is peripherally inserted central catheters, otherwise known as PICC lines. Third one is midline catheter. Fourth one is subcutaneous or tunneled central venous catheter. And the last one is implanted central venous catheter, that is ICVC or Portacath. Based on the type of catheters, it's been classified into single lumen catheter, double lumen catheter, triple lumen catheter, quadrilumen catheter, and multilumen catheter. In the picture, you can clearly see this. The first one is single lumen catheter. This is the double lumen catheter with 2 lumens, triple lumen catheter with 3 lumens, and quadrilumen catheter with 4 lumens. The multilumen catheter is with more than 4 lumens. Next one is hemodialysis catheter. We have 2 types, temporary dialysis catheter and permanent catheter, that is Permacath. These catheters are available in double lumen and triple lumen. So the last one is introducer sheath. So these are used when there is need for a larger catheter, such as for rapid volume administration or for the insertion of a pulmonary artery catheter. In the picture, you can see that. Let's discuss about the type by site in detail. So the first one is percutaneous central venous catheter. So percutaneous central venous catheter or CVC is inserted directly to the skin into the internal or external jugular or subclavian or femoral vein. It can be used for days to weeks. So in the picture, you can clearly see the CVC. The second type is peripherally inserted central catheter, otherwise known as PICC lines. So PICC line is a central venous catheter inserted into a vein in the arm via the basilic or cephalic veins, and the tip of the catheter is positioned in the superior vena cava. It can provide venous access for up to 1 year. So in the picture, you can see that one. It is inserted into a vein in the arm and the tip is positioned in the superior vena cava. The third one is midline catheter. So a midline or midline catheter is inserted into a large vein in the upper arm. It can be used for 2 to 4 weeks. So here you can see the midline catheter. This also inserted into a large vein in the upper arm. So here let's see the difference between PICC line and midline. So in PICC line, the tip of the catheter is positioned in the superior vena cava, whereas in the midline, the tip of the catheter is positioned into a large vein in the upper arm. So the PICC line can provide venous access for up to 1 year, and the midline can be used for 2 to 4 weeks. The length of the PICC line ranges from 50 to 60 centimeter. Of course, it is very lengthier comparing to the midline. The length of the midline ranges from 7.5 to 20 centimeter. That's why it is positioned into a large vein in the upper arm, whereas the PICC line is positioned in the superior vena cava. The fourth one is subcutaneous or tunneled central venous catheter. So it is a surgical procedure in which the catheter is channeled subcutaneously under the skin in the chest area before it enters the superior vena cava, and it remains for months to years, and the risk for infection is less. So in the picture you can clearly see that this is the outer part, the catheter tail, and this is the exit side out of the skin. So beneath the skin, it is traveling up to here, and here is the vein entry. So the main benefit is the risk for infection is less. The last one is implanted central venous catheter, that is ICVC or portacath. An implanted central venous catheter, also called a portacath, is similar to tunneled catheter but is left entirely under the skin and is accessible via a port by Hubbard needle. It is used on patients requiring periodic venous access over an extended course of therapy. In the picture you can see there is an implanted port. Nothing is visible outside. Every time you need to access this port by Hubbard needle. And this is mainly used for patients who receive chemotherapy. So far, we have discussed about central venous catheter, the different types of central venous catheter. Let's discuss about the care of central venous line. Always cover by an occlusive transparent dressing. Follow sterile handling technique. Check for backflow and flush the line before and after drug administration. Keep the clamps closed when not in use. Clean the tip with alcohol swab before and after every use. Change the dressing according to the hospital protocol. Avoid wetting the site while taking shower. If it gets wet or soil, change the dressing immediately. Thank you so much for watching this video. Once you start to work in the hospital, you may get a lot of confusions about the central lines, especially the midline and the PICC line. I hope this video would be helpful for you guys. If you feel the same, kindly like, share this to our friends and subscribe my channel. My channel name is Jebin Shine, and don't forget to press the bell icon button so that you will get the notifications whenever I am uploading new videos. Thank you all. See you all again with one more interesting topic. Until then, it's bye from Jebin. Bye bye. Take care.